Well, good morning. I'm here at Varsity Stadium this morning, and it's the site of a very unique clinic put on by a number of health partners, including some of the leaders from our Indigenous communities, First Nations, Inuit, and Métis. And it's a clinic that is being put on as well with some of our health partners to ensure that the members of our Indigenous communities here in the City of Toronto, some 90,000 strong, can get their vaccinations. Some of the communities in Toronto, different communities, have a little more trouble, either being comfortable with getting vaccinated or with having access to the places to get vaccinated. And so by putting on these clinics that are put on by people that these communities trust in places that they know, we can make sure that our Indigenous communities, which at the present time are maybe only half vaccinated, can get vaccinated and provide them with a degree of protection against COVID-19 and the variants that many other people have. And I guess as an indication of how far behind those communities are in getting vaccinated, I can announce this morning that the City of Toronto in the last few hours has surpassed two significant milestones that really tell us we're well on the way to getting fully vaccinated, but also to the accompanying reopening of the city that will take place on an expanded basis. In the last number of hours, we have surpassed 75% of the adult eligible population of the city receiving their first dose and 25% having received their second dose. And this is a significant accomplishment, and I want to express my thanks to all of the health partners, to the people on the city staff, Toronto Public Health, all of those involved in setting up all the different clinics. There are some 38 clinics going on today and on the weekend to make sure that we can make vaccinations accessible to as many people as possible, because the bottom line is, even at 75% first dose and 25% second dose, we have a long way to go in what is our most important priority. If we want to make sure that the Delta variant does not get an upper hand on us, the best thing we can do to make sure of that is to take what is 75% first dose and 25% second dose as of today, a big accomplishment, and push those numbers up even higher. But that really relies on people out there, the city, residents of the City of Toronto, to get vaccinated. So if you know somebody who isn't, first dose or second dose, please encourage them to do so. We opened up 90,000 new appointments at city-run clinics. Another 60,000 of that 90,000 will be made available on the registration system on Monday. But we need people to sign up and get vaccinated, whether at a city clinic, at a special clinic like this for our Indigenous peoples, or at one of the pop-up clinics that will be held in great numbers through the weekend and into next week. So again, congratulations and thank you for another milestone reached, but it's not the end of the road. 75% first dose, 25% second dose. Great work on the part of the people getting the vaccinations and the people giving them. Thank you to them all. And but let's keep up the great work, because we've got to get a lot further than that.
Mayor, let's start with this event. Certainly we know the goal of clinics in general is reducing barriers, giving people a chance to be in a safe space, whether that's culturally, to get their vaccination. How important is that for members of Toronto's Indigenous community to do that right here?
We are the most diverse city in the world, and that starts with our first people, our First Nations, our Inuit and Métis people, our Indigenous communities, and they have a variety of reasons, historically and otherwise, to be hesitant about coming to a city-run clinic, for example. So what we've done here, and when I say we, it's been really done by the partners, the university and all the Indigenous community leadership and the medical and health people, is to provide a place where people can feel comfortable and safe, where it's culturally sensitive in the way the immunization is done, and where it is done involving people they trust and know. And we're doing that right across the city with all kinds of different groups that otherwise might be not getting vaccinated, to bring those numbers up so that everybody is treated.
You've given us this amazing news that the city reached 75% first doses, 25% second doses. That effectively puts Toronto in a position, if this was province-wide, to move right to stage 3. Do you think we're any closer with these numbers to getting to stage 2 sooner?
Always the case that the 75-25 number was a very important one in the context of having further reopening, but there was a timetable that went with that and other considerations, including hospitalization, ICU, and a number of other things. So I know the Premier and ourselves and others are talking about this every day. We want things to be reopened as soon as possible, but also the timetable was set in place for a reason, to make sure that, for example, people getting vaccinated yesterday, today, the day before, they're not having the protection yet for another 7 to 10 or 14 days. So you have to take all those kinds of things into account, but this is certainly a very positive step forward to good health and to also the reopening of the city.
So are we not there yet in getting to stage 2?
The timetable says we're not supposed to be there until July the 2nd, and these things are under daily reassessment on all the different factors, including how long it's been since people had their injection, because they don't get the protection immediately. So I know, I've spoken with the Premier today already, and I know that these things are all being discussed, but it's just a matter of not being able to just stand out here because you'd feel like it. I'd love to be able to stand here and on his behalf say, we're opening everything up tomorrow morning, but you have to be careful about these things. You have to assess them on a day-by-day basis. I know that's what's going on, and I hope that that means we'll be open as soon as possible.
You got your first shot of AstraZeneca. Do you know what you're doing for shot number 2 yet?
No, and only because I'm trying to get advice on that, and I had been quite prepared to take a second dose of AstraZeneca, and of course what people have to understand is there's nothing unsafe about that at all. 2 doses of AstraZeneca is not unsafe. It's only a matter of the effectiveness of the vaccines taken together, the first and second dose. And so I will do whatever I'm advised to do. I'm like everybody else. I'm going to talk to my doctor, talk to Dr. Dalla, who I can speak to on a regular basis. But the most important thing is I'm going to get vaccinated a second time. And if it's AstraZeneca, that's fine with me. Because nobody said there was anything wrong with it. They just said that maybe a mix of the two would provide a better result in terms of protection against illness. So, I'll do whatever I'm advised to do.
Are you scheduled? Do you know when you're getting shot number 2?
Oh, but the pharmacy that I had the original dose at called to say they have some availability next week. So if I went that route, I could go there, and I also could go to one of these new 60,000 appointments we're opening up Monday morning for people to get their second dose. It'll be Moderna if I go there. So this is what I have to sort out, and I realize what I do, and I don't overblow it. But people watch these things, and so I want to be careful not to send any negative signal at all about AstraZeneca because there isn't one. But just to say, this is the advice that's been given. We all know what's been said by Ottawa, and so we'll take it one day at a time here. Thank you.
Still got it.